This is One-on-One. Dena Seidel is Director of Center for Digital Filmmaking at Rutgers University. Good to see you.
Honored to be here, Steve.
Well, it's good to have you. We are partners in working with the Robert Wood Johnson Foundation looking at childhood obesity, and you and your team are working on a documentary called Generation at Risk. As we talk right now, you're doing this documentary that looks at the problem. We're about to show a clip from it, and we'll come back and talk, but listen, this obesity problem with children is huge. It is a massive problem, but the difference with this documentary is it doesn't only document the seriousness of the problem in the state of New Jersey, but it also talks about some of the solutions. Let's look at the clip, and then we'll talk to Dena.
1 in every 2 of these kids is projected to come down with adult onset diabetes.
New Jersey has the worst incidence of childhood obesity in the entire United States.
How many of you worry about obesity in your families or in yourselves?
You have some of the most vulnerable populations in our country who are going to live sicker and die younger than previous generations.
They just told me that I should eat better, then I could probably get rid of my diabetes.
The supermarkets are not close to where we live at. You don't want to walk because it takes about an hour to get to the supermarket.
When I first was diagnosed with diabetes, I thought that it was going to be the end of my life. I didn't think I would get it at a young age.
It's what you call a systems failure. It's costing us $2.2 billion a year. We have to solve childhood obesity.
It's a powerful documentary. What else are you seeing out there?
We're seeing some incredible collaboration right now. There have been a lot of food documentaries over the last 3 or 4 years looking at the problem, and the problem is acute and complex. But what we're seeing are a lot of grassroots initiatives. And then I'm at Rutgers, and at Rutgers there's the creation of the Institute for Food, Nutrition, and Health, which is
the Institute for Food, Nutrition, and Health.
The New Jersey Institute for Food, Nutrition, and Health, which is an intentionally interdisciplinary research hub. So you have researchers from a lot of different backgrounds coming together to work together to look at this problem as a complex systems failure. So there's the researchers at the university partnering with Robert Wood Johnson Foundation, and then there's a lot of these community initiatives, really amazing local heroes who are out there trying to solve obesity from different angles, because of course it's so complicated. You can have a program that is working to increase food from farm to the city, you can increase exercise, you can offer cooking classes, but you have to sort of look at it as a complex problem and address it with a sort of multi-pronged solution.
It's interesting how the way I introduced this segment, Dena, as I said, that while there are other documentaries looking at childhood obesity, one of the differences here with this documentary is you really are trying to focus on solutions, correct?
Exactly.
And by the way, it is a 3-year initiative?
It's our documentary.
Yeah.
Our documentary project is a 3 to 5 year documentary project. We have support to keep following all of these different initiatives because this is such a complicated problem, and it's so important to the people of New Jersey. I mean, this is about the health of our children and the future of our children.
Explain that part. Following what?
Well, we're following the partnerships and the collaboration. So the New Jersey Institute for Food, Nutrition, and Health is a signature initiative of Rutgers University. It has support from the Robert Wood Johnson Foundation. So we started learning about the complexity of childhood obesity from this interdisciplinary research team, and our documentary team, which is at the Rutgers Film Bureau, which I am the director of the Film Center. I get to work with my students to make long-form documentary projects. We are character-driven stories, so we're not making promotional videos. We are following people over time. These are journeys. These are character arcs.
But you're going outside of Rutgers because you're looking at other organizations. Talk about some of the other organizations that are involved in this fight, this war, if you will.
It is
trying
a
to fight
war.
Childhood obesity. What kind of organizations are you looking at over time?
We're looking at different community initiatives. So in that clip that you just saw, there was Lizanne Finston, right, from Elijah's Promise. You heard
Elijah's Promise.
That's right. That's in New Brunswick. We have a family there. We're following different families over time, because one thing we realized as we learned about the complexity of the problem from, again, this interdisciplinary research team, we realized we had to go out into the community and start listening to the families and to the community organizers, these local heroes who are working very, very hard to address this problem. We have to understand from them what it means to be dealing with this problem on a day-to-day basis. You know, childhood obesity is a threat on so many levels, right? There's the food-related illnesses. This is diabetes, as we know, heart disease, but also there's direct links to cancer now that we're seeing.
Direct links to cancer.
Over time, there's food-related illnesses. They're seeing, the researchers are seeing there's a more and more of a connection to certain types of cancer.
What about also, also going into schools?
That's right.
There are learning issues here. There are educational issues here dealing with childhood obesity, are there not?
Oh, absolutely. I mean, childhood obesity, it's such a multi-factorial.
It's not an issue.
No, it's not. It's a whole system. It's a whole systems failure, isn't it? So you can't just give fresh fruits and vegetables to children and families and say this is going to solve it. I mean, we have one of the families that you just saw in our film, the Rivera family. That young girl at age 17 was diagnosed with diabetes. Now, this is a hardworking family. They care about their children. They are working hard. They even have a garden where they're growing their own fresh fruits and vegetables, but there's no store in their neighborhood for them to have access to affordable, healthy, fresh fruits and vegetables. The neighborhood is not someplace that they can let their kids walk around and play. So we know that diabetes is, type 2 diabetes is preventable, but for some families living under these situations, it's almost unavoidable.
Go back to the school issue, because with all these health-related issues, a child begins to miss school. A child is not totally present when he or she is in school. All sorts of issues there, right? But are you in schools as well?
Absolutely. You saw us in one of the Camden schools there, and we have, that was one of the charter schools.
Excuse me, are you targeting certain communities where you are? Because I know that Newark, Trenton, and Camden are important parts of this initiative. Is that where you are?
Yes, we're in all of these places right now, and we have access through the New Jersey Partnership for Healthy Kids, and that is again supported by the Robert Wood Johnson Foundation. They're partnering with us to make this documentary. So we're absolutely outside of Rutgers, but what we're finding as we're going out into the community and hearing from the families in the community initiatives, that information is going back to the researchers and informing the researchers at Rutgers, and the documentary process in itself is sort of inspiring this two-way conversation between community, families, and interdisciplinary research and science. Because of course, in order to solve this problem, Steve, all of these people have to work together, right? I mean, you need this sort of nexus of initiatives coming together to look at the complexity of this problem, and it's only through this type of collaboration that we can imagine a solution.
When is the, I don't want to say the end, when can people see it?
We're expecting this film to be done in, again, 3 or 4 years.
We'll come back then. I'm sorry for interrupting. We'll come back then, we'll do more.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Robert Wood Johnson Foundation, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. PSE&G, committed to improving New Jersey's economy and strengthening its communities. And by the law firm of GIBBONS, P.C. Promotional support provided by NJ Biz, All Business, All New Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.